My name is Jessica Gates. My student number is 803-243-271. Common abnormal behaviours seen by dogs in a vet clinic can include barking, jumping at the cage, urinating in their cage, scratching at the door of their cage, hiding towards the back of it, aggression such as biting humans or panting. Most of these common behaviours are caused by stress and fear, and sometimes by separation anxiety from their owners. Short-term ways to relieve these behaviours could include enrichment items such as this activity mat, Kongs, or other treats such as liver treats or chicken. So these ones work. So these ones you put the treats inside the thing. That one. So these ways work to distract the dog from thinking about stressing. Other ways that aren't food or treat related are things such as Adaptil, which is a pheromone spray, synthetic pheromone spray, which you can either spray on a towel, put it over the top of their cage or in their cage, or you can spray it on a bandana like this and tie it around their collar. Okay, so another way is a thunder shirt, which is designed to provide comfort and make them feel less stressed. And that goes on like this. So the clinic I'm at has two ways of recording behaviour noted with animals. First way is on the cage card, which you write in the comments section. And the second way is on the computer, which there is two options in that. So you go to the file of the patient, and then there's the behaviour tab, which has the options of not assessed, no concerns, friendly, nervous, care required, and aggressive. And then you click on one of them. And also there is the notes section, which puts that in there, and then that note section will be displayed every time somebody accesses the file. You can also go to this notes section up here, and it will be across there.
Yes, so let's talk about the long-term management of this anxiety
yes.
patient that we have.
For a long-term management program, a person at home with their dog, they could use a dactyl spray or collar.
Yes.
Yep. And then they could also use crating, which creates a safe, comfortable space for the dog.
Yep.
In the home.
Yep.
Also use positive reinforcement for good behaviours.
Mhm.
Or try and reduce the negative ones.
Mhm.
Also make follow-up phone calls to the owners to see how they're going.
Yeah.
And then you can also create follow-up reminders on the computer, which will then send a reminder to the client to email us or ring us. And then also there's a lot of printouts for owners that we can give.
Absolutely. If you want to show me, just pop into the patient tab there. That touchpad's disabled. Just on the patient tab, just click on number 2. And if you go up to the print menu there, yeah. And if you go scroll down to that list of options, you can see handouts. So we have some quite specific behaviour handouts. So there's general behaviour, and there's canine behaviour. What do you think you'd do if it was a behaviour that you felt might be a risk to a family member or a member of the public, any person? What do you think you would do if you thought this might be dangerous? What would you do? What step would you take next?
You would see a vet for it, make an appointment to see a vet.
Yeah, that would be a really good recommendation.
Yep.
Yeah, to refer on for possible, what sort of things could you tell the client why you would say, hey, I think you should see a vet about this because this behaviour needs veterinary advice. So if you suspect there's a threat to someone from the dog's behaviour, and if they asked you questions like, oh, why do I need to see a vet? What can a vet do that you can't do?
They might be able to prescribe some drugs that will calm it down and make it more manageable.
Exactly, and support the behaviour management.
Yep.
So combination of behaviour management and giving medication can help support them. And what about in the reminder set up for our patients? What else can we do there?
So you can set a reminder which will remind them to get therapy medication.
Yeah, and contact
to
us.
Contact us, and
Yeah, we can set up a follow-up reminder, and you can choose what length of time, if you think we need to touch base with them in a month or 3 months, you can plan a reminder to go out to them. Okay. Oh, there we go, that's number 5 on our list. Yeah, okay. How do you feel about that?
Good.